And our invited guest for today is Dr. Clotilda Oliphant. And I think I mentioned some of her CV briefly in my email, in my announcement of this town hall. But just to remind you, she is a public health medicine specialist. Like me and like some of the others that have taught in this module, who are medical doctors who have specialized in public health medicine. And she is based at the Office of the Auditor General of South Africa. And she's also an extraordinary lecturer in our school. This title is a bit different to the others in that in the other ones, we've kind of looked at more macro issues, kind of looking at health systems and, sort of what's going on globally and in the country. But I think this one, we're going to speak more about financial management, within organizations, in your workplace, what are some of the challenges and issues there. And obviously, given the work that Dr. Oliphant does, she has quite a unique perspective. So those of you that are hospital managers or in government, be very scared when you see her arriving at your doorstep, because then you're in trouble. As in the previous sessions, feel free to ask questions in the chat window, but also at the end of the session, you can raise your hand and ask a question as well that way. So I think maybe my starting point for this session is to ask Dr. Oliphant, just in terms, because I think financial management seems very far removed from, let's say, the work we do as public health professionals and as health managers. And so just from her perspective, why she would think that it's important for us as health managers and those working in public health to know something about financial management, and why shouldn't we just leave it to the accountants to deal with? You just want to take that?
Okay, thank you and good afternoon. It's really a pleasure to be back with like-minded colleagues, because I usually spend most of my days in a different kind of sector, mainly chartered accountants, and so the discussions are often very different. But my work is focused on the audits of the health sector. And I was hoping when Sahendra mentioned that there may be health managers or hospital managers, that he would ask them to chip in if ever you want to, because I know that the budget and dealing with financial management is what you are probably faced with on a daily basis. From my perspective, why is financial management important? And I think as a basic building block of the health system, financing is important. It's one of the most important resources. And as with all other resources, it's scarce. And so ultimately, you can think of it inside of a box, as we usually see the UHC box being shown, that maybe on an annual basis might increase slightly related to inflation, but for the most part, it is fixed. So when decisions have to be made about which priorities are we going to finance and which are the important aspects that we think need to be budgeted for, in most cases, it will be at the expense of something else. And so these decisions that need to be made by health managers, and I think you may think it's only on a global scale, but even the health manager in a CHC has to decide, am I going to buy stationery with the money that's left over, or am I going to buy something else? So the kind of decision making that needs to go into financial management is essential and it's important. And I think that's why I had a quick look at some of your curriculum And the principles that I mentioned, that are talking about accountability, talks about transparency, integrity, stewardship. Those are really essential for a health leader. If you are responsible for the finances in your unit, I'm saying your unit because, as I mentioned, it's not just the big hospital or the department or the program. It's also the clinic and the CHC, and at every level that you need to manage resources, you do still need to focus on those essential principles of financial management. So that's just a broad perspective, Sandra. I don't know if you want to go into a little bit more detail straight away. Or...
Yeah, so I think maybe you kind of just touched on some of the principles of financial management, and maybe we can just elaborate on those in terms of the important principles for health managers to consider in the context of financial management.
So in South Africa, financial management is really regulated by the Public Finance Management Act. Sorry, my neighbor has a very loud generator that just went on. I hope you can't hear it. But the Public Finance Management Act is what's usually referred to when we talk about financial management, and it's about how regulations or decisions are made in financial management in national and provincial governments, and the function of all of this, or the principle, the purpose of financial management is really to decide how do we allocate and how do we utilize the important resource of finances. So it's about are the resources allocated appropriately, and the three things that often come up are our decisions that we make economic? So are we choosing the best priced option? Are the decisions effective? Do they give us the effect that we want? Do they work, the choices that we make? So which vaccine do we use? Is it the one that is the most effective, and so on? And then is it efficient? So is it the most value that we can get for the money that we spend? So around economy, effectiveness, and efficiency, we're looking at financial management, and the PFMA also allocates specific functions, roles, and responsibilities. So at national and provincial level, you have the executive authority that's making the policy decision. What are our priorities? And then you have the accounting official, which is the head of department. And the head of department is expected to implement those policies and procedures. So that's just, again, starting from the very high level. How do we then move on to actually making things work? And I've noticed that you talk about the tools for financial management. The most important probably being planning, because that's usually the first stage. How do we start off with our plans? And you would have learned the planning cycle. And for financial management specifically, we need to ensure that the budget is linked to our plans. So when we decide on priorities and plans and what are the areas of health that we think needs to be funded, that is what should actually fit into, or what should feed our decisions on budgeting. So the entire financial planning cycle would start from policy formulation, determining the priorities for the department, deciding how we're going to deliver the service, and then importantly, how do we monitor it? And in terms of service delivery, what's also important is how do we ensure that during that process of spending and decision making, are there controls in place to ensure that both the accounting officer and everyone else that reports along the line is following the rules and is doing what ought to be done to ensure that we effectively and efficiently use the resource. Thanks.
Okay, thanks, Priscilla. So I think you briefly touched on the PFMA your response there. And obviously, the majority of students in the class are South African, although we have a number of international students. So maybe we can just kind of consider the PFMA in a bit more detail, and obviously, often when one talks about sort of irregular expenditure and corruption in the health sector, one often hears about the PFMA being mentioned in the same sentence. So maybe one could just expand on that. But while you're thinking about that, let's see. I think we might have a question there from someone. I saw a hand going up, but I don't. Maybe it has come down. Okay, let's answer that. If whoever put their hand up, please you can just raise it again, and we'll come back to you. But can you go ahead with that on the PFMA?
Okay. Yes, Sayendra, the PFMA was promulgated in 1999, and prior to that, there was a much more centralized approach to financial management. So financial managers or HODs or accountable officers needed to really spend a lot of time back and forth between Treasury for decision making, and to ensure that decisions that are made are actually approved. All of it had to go through Treasury for a long time. Since the implementation of the PFMA, there has been more delegation. So powers have been delegated down to the level of the HOD, for instance, at provincial level, and the municipal manager at the local government level. But what also obviously needs to be done then is to ensure that there is accountability. So while yes, there has been delegation down of powers, the provincial government would manage its own funding or budgets, and the national government would manage its own funding or budgets. But each of those accounting officers have specific roles and responsibilities, and particularly in terms of the accounting officer, they have specific general reporting responsibilities. So an accounting officer must keep full records of financial affairs. They must develop annual financial statements and annual reports. And these annual financial statements and reports are then audited by the Auditor General. The departments must also develop annual budgets and monthly statements, and then there are specific rules also for public entities. So there's two sides of the coin. There is the increased powers given to the HOD, but there is also the increased accountability that, importantly, record keeping is essential. It is unfortunately one of the downfalls in our departments, where we see a lot of the findings that the Auditor General come up with has to do with poor record keeping within departments. Departments are also required to provide information to Treasury and to the Auditor General in terms of any budgetary shortfalls, or if there's been unauthorized spending. And there's usually the three different areas, which is called either unauthorized spending, where money is spent either over the budget or outside of the areas that it was allocated for, or irregular spending, when it didn't follow it was not in compliance with the legislation around supply chain, or it was fruitless and wasteful. So spending did not add to service delivery, or there was generally just a waste of money. For instance, we have in previous audits seen something that can be regarded as frivolous, where equipment was bought. A CT scanner might have been procured, and after 4 years, it is still in its box, unused for many different reasons. Either there was no staff to actually use it, or something went wrong, and the expense was completely inefficient. So yes, the PFMA, I mean, there is quite a lot of detail that we can go into, but I think the important aspects around the PFMA has to do with the accountability and the responsibilities of accounting officers. What the purpose of the Auditor General is, if I can just briefly get into that. The Auditor General is what is called a Chapter 9 institution. So it is established by the Constitution, and its purpose is to protect the democracy. So there are many other institutions that are established through Chapter 9 of the Constitution, and these include the Public Protector, the Commission for Gender Equality, and so on. So there are specific purposes to the Auditor General, and in this case, it is to ensure that public funds are spent in alignment with what it was allocated for and whether there is compliance. So there are different types of audits done by the AG. Some of them are mandatory, and these are the financial audits that are done by accountants. They audit the actual financial statements, and then a second aspect of the audit looks at compliance. So did the institution or the entity comply with legislation? And then the third type of audit is where our business unit gets more involved in, which is performance audits. So we look at how was service delivery accomplished? Was there an achievement of effectiveness and efficiency? And examples, for instance, would be to look at how equipment is managed or how pharmaceuticals are managed at facility level. So, sorry, I've drifted a bit off from the PFMA, but just to let you know where the Auditor General fits into all this. The Auditor General does have its own act, which is the Public Audit Act, that determines what are the rules and regulations around its functions. And those functions have recently been extended to give the AG more powers where accounting officers have, over a long period of time, maybe missed and not adhered to the guidance. So I'm going to stop at that point. Sayendra, thank you. I hope I've answered.
No, thanks, Kusula. So maybe there's something that you mentioned that bears repeating. The differentiation you made between unauthorized, irregular, and fruitful and wasteful spending. I think that might be something that is important for the students to know. Can you just go through those again, maybe with examples?
With examples, okay. So unauthorized spending is where the officer. I mean, this happens quite a bit. When a budget is overspent. So it can be for whatever reason, and the PFMA's intention was also not to put financial management managers in a position where they are completely frozen by the legislation. So sometimes if unauthorized expenditure can be justified or explained, this is often done. So either the budget wasn't used for the purposes that it's intended for, or it was just spending went over the budget. So sometimes it can be as a result of an administrative error. in most cases, it's as a result of just overwhelming need, especially in the health services. And you also find that money is reallocated. So if in your budget you had 100 Rand for equipment and 100 Rand for the HIV program, and then suddenly your HIV program is overwhelmed and you now end up just channeling the money from the equipment budget to HIV that's considered unauthorized, and you need to explain as the accounting officer how that came about. Irregular expenditure, that means your spending was not in compliance with the legislation. So there are specific ways in which especially the supply chain system works. So for certain goods, you need to make use of maybe a transversal quote, or there are specific allocations made, or you must use a certain number of quotations. The whole idea is to ensure that there is an equal opportunity for different and especially smaller businesses. For instance, during the pandemic last year and spending around PPE, there was a requirement that you needed as a health manager to make sure that you also include a certain proportion of local producers in the purchasing of PPE. So there are many requirements and regulations, sometimes from Treasury, sometimes just straight in the PFMA, or specific regulations related to the PFMA that determine how spending should happen. And when you do not follow those, when a tender, for example, the allocation of a tender doesn't follow the process that it's supposed to, and you end up finding that the accounting officer allocated a tender despite the clear group that should have received it not receiving it, but now, and especially this happens quite often, that there is a conflict of interest, and supply chain officers or accounting officers have a conflict of interest and allocate tenders to family members or whatever the case might be. That is considered irregular expenditure. Okay, the last one we mentioned was fruitless and wasteful. I often say that the wrong way around. When pointless spending that could have been avoided is executed, and there was an example of this also last year, and I think there was a question of whether it was irregular and also fruitless, where because of the scarcity of PPE, the prices skyrocketed, and now the same item that might have cost 5 Rand 2 weeks ago suddenly costs 200 Rand. But it can be something simple, but it can also be something like if you don't purchase something within, or if you don't pay suppliers within the specific time and you then incur interest, that's also considered fruitless and wasteful.
Okay, thanks, Clotilda. I'm not sure if there are any questions at this point from the class. Anyone? Okay, you can still note your questions in the chat window. So then maybe let's move to let's say a health facility or a hospital. And so lots of people here would be managers and so on. So kind of what do we think they need to know about in terms of financial management? In most cases, you're going to have a finance person as part of your team, if I could put it that way. Your central hospitals normally have a finance director, and obviously the lower you go down, you probably have other administrators assisting. But as a health manager, what should they know about financial management? We spoke about the tools. So what sort of tools should they be familiar with, and be able to work with?
Yes, I think, and I'm hoping that some of the managers will also come in on the discussion. I was a manager at Tygerberg many years ago, and I know that we had, for instance, a supply chain department within the hospital. There is a CEO, the CFO, and all of what happens. But still, it is important for the manager to ensure that within your department, and I don't know what sort of cost center management is happening at the moment, but as an example, if you are the cost center manager for the pediatrics department, I think it's important on a monthly basis to be able to plan and see that in my cost center, this is the budget. These are the specific areas that we usually struggle with, and I think the idea around this is to be able to use planning. You understand your organization, so you will know how it is structured, what is the policies and procedures, how does it go about doing its business. So once you understand your own cost center and you look at what are the expenses on a monthly basis, because this is exactly how it works at a higher level as well. We start out with a strategic plan that is a 5-year plan for the department. The department then has annual performance plans or operational plans, and according to that, the budget has to be spent over a 3-year. I mean, you can forecast over a 3-year period. The important aspect is that we need to have access to information, both on the needs and the supply side. So we have to look at what is the resources available, what is the budget available, and what is the usual utilization of the service on a monthly or quarterly or annual basis. And I think the important aspect of financial management is really using the information that's available to you. Unfortunately for us, in our information systems, everything has its own system. So you have a BAS, you have a basic accounting system, and then you have a PERSEL, and then you have a supply chain management system, and all of those work in parallel. And so I don't need to tell the managers in this forum, but you need to use several different sources of information and plan ahead and look at how has changes in the environment changed the service utilization at my facility, and how does my budget manage to keep up with what is happening. And I think the last 2 years of the pandemic has probably taught everyone so much around just responsiveness and having to constantly be aware of the information. As a manager, you need to constantly know what is happening in my service itself and what is happening to my funding and how do we allocate based on service delivery, and mostly based on what we want to achieve. Because ultimately, when we talk about effectiveness and efficiency, it's around, are we achieving the health outcomes that we planned or set out to? So are our health outcomes improving? Is the system responsive to what is happening? Do we still have accessible services? So really, I often think I don't need to teach a health manager, but the aspects that are important around your system is always going to be, how do you plan? Does your budget reflect the priorities of that you've set out? And how does your system organization assist you in monitoring and ensuring that everyone is in compliance? We find some of the areas of greatest vulnerability is, as I've mentioned earlier, record keeping, and then compliance with legislation. So how do you manage that supply chain division? Is there regular updates on what is happening? Is there adequate supervision and monitoring? What else? I think we've spoken about consequence management. That's difficult, but consequence management is actually so important. When something has gone wrong, it has to be addressed. And what often happens is we all have this, well, it's been busy and we all struggled, but consequence management has been highlighted as one of the root causes for persistent findings in departments. I've seen that there were quite a few notes coming up. Unfortunately, I haven't had a chance to look at the questions, Sahendra.
Yes, so no, we will get to those questions, but maybe one thing that we need to clarify, because you know, some of the students here would have had, well, some would have had exposure to sort of management, others would have not. So one of the terms you mentioned was cost center. Maybe you just want to clarify what we mean by that term.
Okay, so, and I'm going to ask the managers who are currently there to also come in. But in terms of cost center management, it has to do with how the budget is allocated within a facility. So within a hospital, for instance, you might have cost centers that are related to service delivery disciplines. So in a very large academic hospital, there might be a cost center for, let's say, pediatrics. I started with pediatrics, and we are talking about a sum of money. If a budget has R1 billion, if a tertiary institution has R1 billion budget for the year, then I don't know about a proportion, but maybe 400 million is allocated to the pediatrics department. That will include, it's too small, but that will include allocations to personnel and allocations to what is called goods and services. So usually the allocation to human resources is around 60 to let's say 65% of the budget, and the rest of it has to be spent on everything else. So within a pediatrics services, that cost center will include everything from health technologies to pharmaceuticals, that's medicines, to testing, your radiology services, and everything that relates to service delivery within that discipline. So I use the term cost centers because that is what this manager will be responsible for. If you are the manager of the pediatrics discipline, then you are responsible for that budget. And that is the kind of allocation that I was referring to.
Okay, thanks, Tatula. So let's look at some of the questions. I'm not sure if you can see it, but I'll read it out anyway, just for the recording. So this is from Makupe, I think. If the accounting officer gives a tender to a next of kin, and that particular service is really needed by the facility, and the company provides it, will that still be regarded as irregular expenditure?
Okay, it's a very specific question. I think maybe to just elaborate that there are very many rules, and there are also rules around the rules around integrity and conflict of interest usually have an what's the word I would look for, where you can come in and declare upfront. You can say upfront, I noticed that this company that is putting in a tender is someone that I know, and I'm declaring it, and maybe for some of the decisions that I'm making, I'm going to excuse myself. So there are mechanisms of mitigating the risk of an accounting officer's conflict of interest. It doesn't necessarily just outright constitute irregular expenditure. I was just trying to find an example.
Then the next one from Moritele. Looking at the corruption in the Gauteng Department of Health, how is the upcoming NHI going to be implemented safely without corruption?
Sure. I want to put it back to you. I think the importance of controls and the importance of consequence management, transparency, accountability, the integrity, it's just, it all comes down to financial management. That's really what it is. How do we manage it? And I think as long as the department is aiming to put controls in place or aiming to find some ways of mitigating the risk, it is concerning, and I think knowing where we're coming from puts us in a position to start putting things in place. The AG does have more powers that allow for specific findings to be addressed in a different way. So from now on, so for the future, the AG can, for instance, refer a specific accounting officer for further investigation and even specific penalties. But really what we want to do is we will need to change the system from within. South Africa is not the only place, I have to say, where there is corruption. It is really overwhelming for us to see it at the moment. So we have to just work at it. The NHI is still in its early phases. So there is opportunity for government to institute risk mitigating and control systems. Thanks, Sandra.
And for those of you that were here last week when Prof. Book was talking, remember we spoke about the fact that in terms of NHI, there's obviously going to be a national health insurance fund, which is your central pool, and that fund then would contract with service providers. And I think one of the issues is that actually, you're bypassing your provincial Department of Health there, because essentially you're contracting with health facilities or districts to provide services. And so there's going to be a shift, because essentially at the moment, in terms of the money, where's all the money? The money at the moment is in your provincial departments of health, right? Because they, we're in a sort of semi-federal system, and your provinces allocate funds for health, and then your provincial departments of health manages that money. And that's why you're right, and Clisella will not say it, but I will say that's why you get a lot of corruption in your provincial departments, because that's where the money actually is. Now in NHI, you're going to see a shift in that the money is going to be in your NHI fund, but then contract to your service providers. So the question is, what mechanisms are you going to put in place where the money is at that NHI fund to make sure you have your mitigation controls there, which would be more important than, you know, your provincial departments of health, who essentially are going to have a much more diluted role when NHI is implemented. And I think, and one of the issues that Prof. Book raised was the fact that this NHI, you know, currently, as it's planned, that board reports to the minister, which gives the minister a lot of power. And we now have some experience in, you know, when there are allegations of corruption against a minister of health. So, you know, one needs to consider what one does there to make sure there's more controls and there's not a single individual that has so much power over, you know, that amount of funds. Marichella, I hope that kind of partly answers your question. Then the next one from Shwaro, is it possible for some of the budget, especially in a municipal setup, to be, I think he means ring fence. Yeah. Can be for a specific unit, not the whole municipality, to avoid irregular expenditure and to avoid the budget running out and critical municipal health functions being neglected.
Okay, just to quickly, Moretele mentioned the Gauteng, but yes, the risk will actually be much higher because now the funds will be, all of the 260 billion approximately that is being spent at the moment nationally, between national and the provincial governments, will be in one place. So yes, there is a risk, but as mentioned, there needs to be tight controls and there needs to be the oversight and accounting for this needs to be tightly controlled. Is it possible for the budget, some to be ring-fenced? So what happens at the moment, and we didn't really talk about how budget is allocated, but each of the provinces, obviously, I don't know if I need to say, but each of the provinces receives funding that is an equitable share that comes straight from Treasury, and also a conditional grant. So the conditional grants have what you are referring to, the kind of ring-fenced requirements. It needs to be spent on particular programs or areas, and there are specific indicators and performance targets related to these. I refer to the provinces because that's where most of the health expenditure sits. With respect to the municipal budget, I have to say, as far as I'm aware for health, there is some municipalities that still receive funding for certain clinics or primary healthcare services. And then, of course, environmental health services, some are still being delivered through the municipalities. For the most, I am not really that aware of how funds are spent in the municipalities elsewhere otherwise. So I'm assuming that a municipality receives funds allocated for specific spending budgets or areas, but I refer to the provincial setup, if I can put it that way, to say that yes, some fundings is specifically, you can call it ring fenced. It means if it means that it comes with specific performance targets. So for instance, each province will receive a conditional grant for HIV, TB, and if it's relevant, malaria, and some other services have also been included in that grant now. And that grant is required to be spent on those conditions and have specific targets that the province must meet relating to HIV, TB, and malaria services, and so on. I'm not too sure about the municipal side.
Yeah, yeah, municipal side, I'm not too certain about. For how long can organizations have month-to-month arrangements with suppliers without formal contracts, and is this irregular?
Sure. Okay, so I am not certain exactly about what the supply chain rules are. As I've mentioned, usually my accountant colleagues will be able to tell you exactly what is allowed and what is not allowed. So for how long can they have month-to-month arrangements with suppliers? There will definitely be policies and procedures around this. And usually the AG will just assess adherence and compliance with what the policy frameworks states, and I unfortunately don't know exactly what these are. Is that okay? Saindra, you're mute.
Sorry, thanks, Clotilda. I'm not sure if Marcella wants to make a comment on that, because I see she's just put a full stop. I think I'm not sure how one interprets that. And Kuleko is asking: is the board that will be appointed for NHI independent of political interference, such as the OHSC, to ensure transparency in the management of the pool funds?
Will the board be independent? Yeah. Independence is difficult, and maybe Sayendra, you can also speak about independence and the OHSC. You have to consider that the executive authority, that's the minister or the political leaders within a province or within at national level, is supposed to provide the policy framework for the department. And I don't know if that will ever be independent of political interference, but the board is supposed to always be independent. Sayendra, I don't know if you want to add anything.
Yeah, I think the concern is that these boards are appointed by the minister and report to the minister. So, and that's a concern. And you say independent political interference, such as the OHSC, but the OHSC board is appointed by the minister and reports to the minister. So, but the question is that the model that we want to have? And I think there's lots of noise at the moment when NHI is discussed from civil society to say, let's look at this and let's make sure that they're truly independent. And can we have another mechanism where where the minister actually has no influence on this? And I think Clotilda, would the Auditor General or your Chapter 9 institutions be examples of this, where you don't report to a minister? My understanding is you're accountable to Parliament, but maybe you just want to clarify that.
Yes, I think they can only really. I don't say they can't be independent otherwise, but it's difficult to be independent when you are also reporting to the minister. So in the case of the AG, yes, because it is established outside and it's established in the Constitution, it is independent and it reports directly to either to Parliament or to the legislature at provincial government. And if additional steps needs to be taken, this goes to SCOPA, and the SCOPA will then call in the relevant department minister and take the matter further. So in the case of the AG, yes, it is completely independent. And I think maybe there should be an independent body. I don't know how it will be established, because whenever anything that is established under the National Health Act will report to the minister, or any of the related acts to the Health Act reports to the minister. And that's, I suppose, the difficulty.
And yeah, you see, using a number of acronyms that I think we need to clarify.
What did I say?
Now, SCOPA. What for the students? What is SCOPA? I think it's the
Oh my
Standing Committee
gosh.
on Public Accounts, or
It is. Thank you. It is. Okay, so when the Auditor General reports to Parliament, for instance, it is responsible to report annually, at least annually, to Parliament, and and for anything like last year we did the special report on the COVID-19 interventions. For the health section of those interventions, the report is made to the Portfolio Committee for Health at Parliament, and also within the legislatures. That's each province's parliament, if I can put it that way. Sorry, I lost my track of thought. What was I saying? You asked me about SCOPA?
No, we were just clarifying what SCOPA is. So we did say Standing Committee on Public Accounts, and yeah. So I mean, that's really your oversight mechanism.
Yes. So I was saying.
Yeah.
Sorry, that we would report to the Portfolio Committee, and if there are matters that the Portfolio Committee deems needs to be taken further, this will be forwarded to the Standing Committee on Public Accounts, and both AG as well as the relevant department will then report to SCOPA on whatever matter it was. Yes.
Okay. Yeah, and obviously I don't know this very well, but the one thing that stands out for me for SCOPA is that it's normally led by a member of the opposition. It's not the governing party that is the chair of that committee. So I think the current chair is from the IFP. Yeah. Okay, so colleague, students, any further questions for Dr. Oliphant? We're almost out of time, so your last chance to ask a question. Going once, twice. Yeah. So Crystal, thanks so much for making time to join us for this session. I think it was very useful, and we've covered quite a bit of ground, and I think it kind of also helps to think about some of the theory that the students have learned this week, just from a practical perspective of somebody that does this sort of work.